There's a question people always ask me is this different from, is lipoharvesting, in other words, taking fat out to be used for fat grafting, different from liposuction? And the answer simply is yes. So I wanted to qualify the difference so you understand the difference between the two. Lipoharvesting, or harvesting fat, in essence is very similar to liposuction because I am suctioning the fat out in a way that's similar to liposuction. The principles of lipoharvesting in terms of how to harvest fat evenly is similar to liposuction. You use those techniques. So for example, if you're not experienced with liposuction, you can create irregularities in the area of harvesting. You can over-harvest one area. So the principles of liposuction and lipoharvesting, the technique is very similar, and that means making sure you go back and forth, move back and forth, not twisting the cannula, causing problems. And so I wrote a textbook in 2006 called Complementary Fat Grafting, which became the world's best-selling fat grafting book for quite a while in terms of its presence academically, lectured across the world on this technique. But even though the technique of harvesting is very similar between the two, in fact almost identical in certain respects, there are differences. So let me explain to you what the difference is. The first of all is the sheer volume and quantity of removal. So people always wonder, is it going to be a lot? And it is actually very, very little. So I'm going to give you some understanding. So generally speaking, in terms of safety, and I don't do liposuction, I only do lipoharvesting. So I don't want to say anything that's wrong here because I don't do liposuction, but I think it's worth to give you some ideas. So liposuction takes liters usually off the body. And so on average, maybe several liters. And you want to be careful, is what I hear, because again, I don't do liposuction, that you want to be careful with things over 5 liters or 6 liters because there's too much risk of electrolyte disturbances when you get up high, and there can be problems. But how many, what is a liter? So a liter, as you know, if you guys are, you live in the United States, we're not as accustomed to think in terms of metric things, but essentially it's 1,000 milliliters, and 5 milliliters equals 1 teaspoon. Okay, so 5 milliliters equals 1 teaspoon. So that's a lot of teaspoons. Okay, 200, I guess, if you do the math. If you're or 400 or 600 teaspoons. That's liposuction again. I'm not doing liposuction. So the quantity that I'm removing, like let's say I just did a fat graft this morning. So it's I harvested 4 times 8. So I harvested 80 milliliters. This morning, and I injected probably about 20 milliliters. Now, out of that 80 milliliters, there's a lot of some fluid, tumescence fluid. I use a couple hundred cc's of tumescence fluid. So part of that's tumescence fluid. Some of it is lyse fat cells that are not going to work, and some of it is just some blood or lidocaine, or I've mentioned that already, tumescence lidocaine mixture. So honestly, out of the 80 milliliters, I probably took only about 40 out of the body. So 40 milliliters, to do the math again using non-metric system, is and sometimes I take out 100, 150, but let's just say, okay, let's say 100 on average, 100 milliliters I'm taking out. Out of 100 milliliters, I'm really probably only taking about 50 to 60 usable fat out of there, or just fat. So let's say it's 60. Out of 60, if you divide it by 5, it's 12. So that's 12 teaspoons total, and that's per side. Let's say I do it on 2 thighs, that's 12 divided by 2 is 6. So 6 teaspoons per area. So it's a very small quantity of fat that I'm actually removing to be re-injected. So a lot of people think you need a lot of fat to fill a face, and you actually don't. It's the amount of volume you have lost over 30 years of your life or 20 years of your life is a matter of teaspoons, microscopic amounts. Now, I'll be very honest with you. If you look at patients that look overfilled, it's usually because they put it in the cheeks, they put it in the lips, and you can put very little and look weird. I used to put in 1 milliliter. That's 1/5 of a teaspoon into this area, and I don't like my patients the way they look after 10 years. I've had to go back and suction that out. So the anterior cheek is very unforgiving. You see patients that say, oh, I only had 1 syringe per side under my cheeks, or I had a half a syringe in the anterior cheek. They progressively look weird. So the anterior cheek for me is a no-fly zone. Sorry for that little bit of an aside. But just so you understand that when I fill the face, I don't put it in the anterior cheek, but even a small degree can be distorting. But the total amount is very, very small. So if you compare that, again, going back to milliliters, which is an easy comparison, let's say I'm taking 60 milliliters of, sorry, not milliliters, 60 cc's of, or milliliters, 60 cc's of fat or 60 milliliters of fat for my harvest when I'm doing, if I were to do liposuction, which I don't perform, but if I were to perform body liposuction, I'm probably taking about 2 or 3 liters off, for example. And remember, a liter is 1,000 milliliters. So that's 2,000 to 3,000 milliliters versus 60 milliliters. So the sheer quantity is very different for lipoharvesting versus liposuction. And the person that's usually very, very heavy set may not need fat grafting, or they may have a lot of fluctuation issues of weight that may be a problem. And you can listen to some of my videos on that. I just recently shot one called Ozempic and fat grafting, but that's outside of the scope of this discussion. So quantity is very different. The second is the technique. So remember, I told you the actual principles of my cannula movement are very similar between the two, but the difference is actually not the movement of the cannula, but how I do it. So I actually have a body surgeon, a body plastic surgeon that comes and does liposuction, and I have all the equipment. So it's not that I don't have the equipment for liposuction. I have it all here, but I have all different types of ones. I have this fancy tower that costs tens of thousands of dollars for this suctioning, but he does that because it's high velocity removal. So they place a ton of tumescence. I put very little tumescence. That's basically saline or fluid to help caress the fat out. They use a ton of tumescence. They use a machine to have high velocity, high removal, because if you can imagine, trying to hand harvest several thousand milliliters of fat is exhausting and probably inaccurate in a way. But for me, I do it all by hand. And so what I mean by all by hand is that there's no machine attached to my hand. I have a syringe, 10 milliliter syringe, and I'm gently harvesting the fat. The reason why that's so important is that if you are using high velocity suction, wall suction, whatever it may be, you can destroy the fat cells. And so for me, when I take that fat out, I'm harvesting it to be re-injected. So I want quality of that fat. So that is a huge difference from how because their end goal is destruction. Get rid of the fat because we don't want it. My end goal is how can I use that fat for a purpose. So this, besides quantity, even though the principle of movement of my hand would be the same in liposuction, I'm doing it by hand with a gentle negative suction to a 10 milliliter syringe versus hooked up to a huge tower that's suctioning the fat at high velocity. The third difference is after that fat is removed, they will probably throw it away. I am actually processing it through something called pure graft, which is for me a very precise way of making that fat viable for re-injection. I've done a video on that. I'm not going to go through that because even though that is a difference between the two, I'm really focused on the removal process. So to understand the process of fat grafting, there are 3 phases. There's LipoHarvesting, which is the subject of this video, processing, which can be done either through washing or washing/filtration, which is the method I use, versus centrifugation, which is what I used to use. And maybe I should do another video on that one. And then finally, it's infiltration or injection of the fat or placement of the fat. So we're just talking about phase 1 and distinguishing that phase from liposuction. So that patients always ask me this question, and I think it's worth to discuss it. And so you don't have to be overweight or fat for me to harvest. It takes just a little bit. Now, if you have almost no fat, then I may take it from the butt or somewhere else like that. But generally speaking, I should mention this, is I want the best, healthiest fat to take it out. So a lot of people say, will I have a contour improvement in my body? Usually not. When I do the hands, and if you have a decent amount of fat in one area, I may be able to give you a little improvement, but because it's a small quantity, usually not. But the reason I mention the hands is the hands take more fat for me to get that result done. But in general, the fat needs to be harvested, and I try to harvest from one site. And the reason is that when I go back through an area that's already been liposuction, there's a little bit more scar tissue. I worry about a little bit more viability, so I try to concentrate it. So I look at the best fat reserves to get the harvest from. So a lot of people say, well, can you take it from my love handles? Usually love handles actually don't have great fat. So I look not at how can I help you look better with the fat harvesting, but where can I get the best fat for your destination, which is your face, not can I get your love handles away. That is liposuctioning. And also, if I didn't mention this, I work with a body plastic surgeon who can do liposuction the same time I harvest. My only exception to that rule is if I'm doing a very complicated deep neck, facelift, fat graft, everything, and it's already a long surgery, and he's doing a tummy tuck, abdominoplasty, everything, for anesthesia safety, I probably won't put all that together. But if I'm just doing a fat graft and he's just doing some liposuction, absolutely no brainer. That can be done the same time, but I've got to harvest the fat first. So actually, that's another good point, is that if you're planning liposuction, please let me take the good fat first, because once you've scarred it all down, suctioned everything away, all your good fat, and I have nothing to use, I'm not a happy camper. And what I mean by that is I don't have the good fat to inject back into your face. So this is a short video about lipoharvesting versus liposuction. I hope I've answered all your questions. If not, you can ask a question in the comments and I would be happy to try to answer it for you.